I'm Garvin Lynch. Welcome to the Lynch's Pharmacy Health Information video series. This video is on Difene. Difene contains the active ingredient Diclofenac, which is a non-steroidal anti-inflammatory analgesic. It is used in the management of rheumatoid arthritis, osteoarthritis, ankylosing spondylitis, acute musculoskeletal disorders. It is also used in the management of pain and inflammation associated with orthopedic, dental and minor surgery, as well as dysmenorrhea and associated menorrhagia. It comes as a blue transparent capsule containing enteric-coated pellets. The dose for an adult is 75 mg to 150 mg, which is 1 or 2 capsules daily in 3 divided doses. The maximum total daily dose should not exceed 150 mg. For a child weighing 35 kg or more, the dose is 2 mg per kilogram body weight daily in divided doses and is not applicable for gout in children. This drug is contraindicated in patients with hypersensitivity to diclofenac, active gastric intestinal ulcer, or the last trimester of pregnancy, severe hepatic, renal or cardiac failure. Difene is also contraindicated in patients in whom attacks of asthma, urticaria or acute rhinitis are precipitated by aspirin or other NSAIDs, established congestive heart failure, ischemic heart disease, peripheral arterial disease or cerebrovascular disease. Special warnings for Difene include the following. Like other non-steroidal anti-inflammatory drugs, diclofenac may mask the symptoms and signs of infection. To reduce the risk of GI toxicity in patients with a history of ulcer, the treatment should be initiated and maintained at the lowest effective dose. Patients with a history of GI toxicity, particularly the elderly, should report any unusual abdominal symptoms, especially GI bleeding. Close medical surveillance and caution should also be exercised in patients with ulcerative colitis or Crohn's disease, as their condition may be exacerbated. The use of products containing aspirin are likely to increase gastrointestinal risk. Close medical supervision and surveillance is required when prescribing diclofenac to patients with impaired hepatic function, as their condition may be exacerbated. Monitoring of renal function is recommended as a precautionary measure when using diclofenac in cases such as impaired cardiac or renal function, the elderly or patients receiving diuretics, and in patients receiving long-term treatment with diclofenac. Appropriate monitoring and advice are required for patients with a history of hypertension or mild to moderate congestive heart failure, as fluid retention and oedema have been reported in association with non-steroidal anti-inflammatory drug therapy. The common side effects include headache, dizziness, nausea, skin rash, indigestion or abdominal pain. Taking Difene at the same time as alcohol can potentiate the undesirable effects caused by the active substance diclofenac, especially those affecting the gastrointestinal tract. Difene can interact with the following medicinal products: lithium, digoxin, diuretics, other non-steroidal anti-inflammatory drugs, corticosteroids, anticoagulants and antiplatelets, selective serotonin reuptake inhibitors, antidiabetics, methotrexate, cyclosporin, quinolone, antibacterials, phenytoin, and sulfapyrazone and voriconazole, aminoglycosides and probenecid. Difene should be avoided during the 3rd trimester due to potential harm to the newborn. Also, labour may be delayed and its duration lengthened when taking Difene. Difene passes into breast milk in small amounts, so the level is too low to cause any harm, but it is advised to avoid administering the drug during breastfeeding. So the use of Difene may impair female fertility and is not recommended in women attempting to conceive. So usually Difene does not affect your ability to drive and use machines. However, it may make you feel dizzy, tired, sleepy, or have eyesight problems. If any of these affect you, do not drive or use machines and contact your doctor immediately. If you have any other questions, you can contact me through the live pharmacist on the website. You can email me or come into the pharmacy in Broaddale in Douglas. Thank you for watching.